want to say good morning and to say on behalf of the Oregon Health and Science University School of Public Health and the Portland State University Homelessness Research and Action Collaborative, welcome to our symposium on homelessness, racial equity, and COVID-19. I am Marisa Zapata, and I'm the director of the Homelessness Research and Action Collaborative. I want to acknowledge that Portland State University is located in the heart of downtown Portland, Oregon, in Multnomah County. We want to honor the indigenous people whose traditional and ancestral homelands we reside on. We acknowledge the ancestors of this place and recognize that we benefit from the sacrifices forced upon them and their descendants. Specifically, we acknowledge the Multnomah, Clackamas, Tumwater, Watlala bands of the Chinook, the Tualatin, Kalapuya, and many other indigenous nations of the Columbia River. In remembering these communities, we honor their legacy and the continued resilience of their descendants. The idea of the symposium did not come from ATRAC. I want to thank Dean Gangsberg from the School of Public Health for bringing us this idea after collaborating with a very generous donor, Richard Royce, and his partner, Rocky Bloomhagen. I hope I got that last name correctly. We were really excited to bring together researchers, both from practice and advocacy, as well as more traditional academic researchers, to continue to demonstrate the evidence basis that we know continues to show that the solution to homelessness is housing and thinking about what supports could be helpful to people who are looking to stay in or access housing. While we were going to do this before COVID started, and of course we've been delayed, and it's been tough to figure out when is the right time to try to do something online. Should we wait to potentially be able to do something in person? And of course, realizing that there may never be a great time, we decided to forge ahead. And while nothing has been good about COVID, I think we are at a point of reflection on new insights such as hotel and motel programs, ideas about how to deliver services. I mean, the idea that we would ever do service delivery online, unheard of before the pandemic, and continue to advance the solutions to homelessness despite the hardship of the virus. We're seeing for the first time that massive federal investment in eviction prevention actually helps us decrease the amount of homelessness or prevent homelessness. And so continuing to look at this work and to continuing to say, we know what we're doing, we know how to do this. And here are some of the latest thinking around these issues. The other thing about this timing is I think that in particular in Portland, COVID-19 has unfortunately brought a changing sentiment on how we should potentially be addressing homelessness. Prior to COVID, or just at the beginning of COVID, the region passed one of the nation's largest homelessness services and prevention revenue measures. Combined with our affordable housing measures, we have hundreds of millions of dollars flowing into the region for what could be the first time game-changing money to prevent and resolve homelessness for thousands and thousands of Portlanders. Right now, we are seeing a pivot more to what many places have seen around the country, which is the focus on creating camps. And of course, we're not really sure what those would look like because there's never details in those plans. And the language that's used to promote them is around this humanitarian support without it being clear that that is actually what would happen. We're also really seeing the misuse of information and data, research design, research questions that go out for the purposes of polling that are quite disingenuous. Last week on our National Public Radio affiliate here in Oregon, OPB, a prominent lobbyist here in Oregon representing business interests here, just got on the radio and said, well, our continuum says X number of people are experiencing homelessness, but we know it's 3 to 5-fold that. And no facts, no basis for that, and an indication that this is not someone working in homelessness, because of course, we all know that 5 times increase in unsheltered homelessness would look quite differently than it does right now. And so I think that the more that we can have the opportunity to come together and to share information and continue to promote the research that advances this conversation, the better. The other thing I'm really hoping that happens today, hopefully people will learn new things, whether you're here for one of two public talks or you're here for the duration of the day. I am really hoping that I certainly thought that COVID was coming to more of a close. And we obviously all know that that is not what's happening right now. And I really hope that today you find strength and community in with one another, in hearing validation of the work that everyone is doing and the opportunities to continue to build power and networks around the country. All right. I'm going to start off by introducing, well, not start off, I've obviously been talking probably longer than I was supposed to. Sorry, team. I'm going to introduce Shannon Singleton. We're honored here to have Shannon with us today from Governor Kate Brown's office. Shannon is the Director of Equity and Racial Justice, where she worked with the governor to create, and she now leads the Racial Justice Council, first in the state to really focus on advancing racial justice. Shannon is on our local advisory board and was previously the executive director at Join, one of our prominent service providers in homelessness. And I still love everyone. I'm just saying Join is great because Shannon's right here. Join is great, particularly with their work on racial justice. I think more importantly, Shannon holds in her heart the experiences of people experiencing homelessness, who have experienced homelessness, while also bringing that to intense policy and program development conversations in a way that I've never seen anyone be able to do. I know that when she's talking, when she's sharing ideas, those experiences are with her, and that is what she is thinking about. She is my first call whenever I have a question about homelessness or a harebrained idea, and she is always happy to tell me yes or no, that's a silly idea. And more importantly, I am just proud to call Shannon a friend.
Thank you so much. That was a very, very sweet introduction. And I just appreciate my friendship and working relationship with you both of them as well.
Recording stopped.
Thank you all so much for making some time for me today.
Recording in progress.
Sorry about that. So I did want to share just a few moments about the Governor's Racial Justice Council and what we're doing there. This council really came about while COVID was already impacting our communities, and we began to think about what does COVID recovery look like. But frankly, we're not saying much about the murder of George Floyd and the impact on Black and Brown people in our communities and the call for racial justice. Really then focusing on how do we create a space where Black and Brown people in our communities, our voices are centered. Our voices are centered in policy development and budget development. And particularly with Governor Brown's council, we were able to focus on the statewide budget and the governor's policy decisions. We really started with 6 different committees. So looking at health equity, environmental equity, criminal justice reform, educational equity, economic opportunity, and housing and homelessness. And how we operationalized racial equity in this work at the state was with very specific investments. Because of the work of these committees in this council, we really prioritized investments across all of those policy areas. But in housing and homelessness, there were 2. One was about homeownership for communities of color, with some very specific investments in the types of models of homeownership, as well as serving communities of color by focusing those investments to culturally specific providers. Additionally, it was due to the work of this committee that we really pushed to have state resources flowing for rent assistance, for eviction prevention in particular. Before the federal government stepped in to provide some additional assistance, for the first time ever, our state decided to take our allocation of community development block grants and utilize that, a portion of that for rent assistance services. We worked with the legislature to invest state dollars in rent assistance because we knew we had an increase in need happening during the early shutdowns of COVID. I would say The other big priority, so looking at the short term, but also looking at the long term, and this committee prioritized a bill and passed a bill that was frankly more difficult than I think it should have been, to really look at removing the ability to deny rental applications based on criminal history. We are one of the states to now have a statewide requirement for landlords to conduct an individualized assessment for people who are attempting to move into their apartments. So as opposed to looking at a certain crime or a name on my history, you now are engaging in conversation with me and looking at the circumstances that surrounded my conviction, so as to have a more equitable opportunity to move back into housing. I would say just a couple other pieces about the COVID response that I think were extremely important that we should hold on to. One was really looking at these lease prohibitions against working from home or working in your apartment, and what was the impact that really had for people who rent. And in our community, the percentage of renters of color is much higher. So what does that look like when you're in a stay-home order and you're told you're not supposed to be able to work from home? When we started eviction moratoria, we were seeing people get notices based on this concept of violating lease from working from home. We had hotels denying people who were being referred by homeless service providers. And so working with our partners at the state to say that is actually discrimination and you cannot do that, and issuing guidance around what was actually appropriate responses. I would say the other big piece about our state dollars was focusing on how do we serve communities that won't meet the requirements of FEMA around citizenship. So making that flexibility around our state dollars to really focus on communities that would not receive other types of benefits. So just wanted to share a few examples of operationalized racial equity at the state government. We have a lot more work to do. The council is now a permanent fixture of the executive branch, and so we will continue to work to really infuse this into everything that Governor Brown and future governors do. So thank you again for making some time, and Marisa, I will hand it back over to you.
Thanks, Shannon. Thanks for sharing all that great work that y'all have been doing. And I'm sure anybody who wants to follow up, Shannon would love to continue to share what they've been up to. Now going to hand it over to David Gangsberg. David is, well, Dean Gangsberg. Sorry, we're in a formal space. Dean Gangsberg is the Dean of the School of Public Health at OHSU, and he will be introducing our first speaker today.
And but before we do that, we want to just take a couple moments to talk about a few housekeeping things. And Zini and I would like to introduce ourselves. Zini, do you want to kick us off?
Yeah, absolutely. Thanks, Katie. Hi, everyone. I'm one half of your facilitation team. My name is Zenia Junkir. I use she and her pronouns. Katie, if you want to introduce yourself, and then I'll just do a little bit of condition setting.
Yeah, sounds great. Hi, everyone. I'm Katie Sawicki. I use she, they pronouns. And I am the other half of your facilitation team.
Awesome. So I know that we've got a lot of things to do today. And one of the things that we really wanted to do was just ground in the conditions for the day. So we're going to put up the PowerPoint, I think slide 9, invitation for shared practices, as I'm talking a little bit about condition setting. So you know, we worked with the HRAC team really intentionally around this facilitation to ensure that, you know, you all are bringing tons of content, amazing, incredible work, excitement for the work, questions about the work. And we really wanted to just make sure that we were grounded in the theme for the day, that we can be grounded in racial equity, that we can be grounded in intersectionality, that we can ground in understanding the ways in which communities face oppression, the ways in which systems of oppression impact communities. As Marisa mentioned early on, I think it's going to be really important that we, let's see, can we go, I think it's back a slide, it's called Invitation for Shared Practices. I just want to make sure that everyone saw this slide scrolling through. It's really an important slide for us, in part because one of the things that we're going to do here as facilitators is just try to ensure that the space is as inclusive as possible. And that means that we're really going to ask folks to engage in these kind of shared language, shared practices, right? This is an invitation for you all. If these are not practices that you generally use or beliefs that you hold, maybe we can just think a little bit about what does it mean to be in a space where we're having conversations about individuals for whom identities are targeted by systems of oppression, and again, that we know are impacted by other identities that they hold, including racial and ethnic identities. So it's going to be really important that we interrupt and disrupt when oppression happens in this space, and that we also uplift and center community-led solutions, community voice, and the ways in which we know communities hold solutions to the issues that they experience. So I'm going to send it over to Katie, and she's going to tell you a little bit more about some logistical pieces.
Yeah, so today will be a kind of a mix of, we've got some amazing keynote speakers, some presenters. We'll have Q&A sessions. We will also be doing a few small breakouts, really quick, what we're calling speed breakouts, where we're hoping you all actually have an opportunity to also be in community with each other, building community with each other as we all kind of grow the community of folks in this work. So expect that, lean into those sessions. We're really excited about them. And then a couple of housekeeping pieces. We want to make sure folks know to enable your screen reader support. You press Control-Alt-Z. And to learn about other keyboard shortcuts, press Control/. And the last piece we did want to talk about was around, because we don't have an opportunity to introduce everyone, we are asking that folks identify their pronouns, their preferred pronouns through the through their Zoom name. We know that one of the ways in which transphobia really shows up is through the assumptions we make about each other's gender identity. One of the ways that we can really combat that is through the use of pronouns and sharing pronouns. So logistically, how you do that is to look in your screen. There are 3 dots in the top right corner of your screen, of your beautiful face. Press on that, and then you'll see an option to rename, and then your name will pop up. And next to that, you can add your pronouns, and we're asking that folks take a moment to do that right now. Additionally, if you would like closed captioning to be available during the breakout rooms, we are asking kind of 2 options. One, if you feel comfortable additionally adding a -CC next to your name, preferred pronouns. If you don't feel comfortable doing that, please do reach out to the host directly, and we will make sure that you are put in those in that small breakout room. And with that, I believe we are handing it to David to introduce our first keynote. David, do you hear us? Checking in.
Thank you. Thank you very much.
There we go. Hello.
It's a real, thanks Dr. Zapata for organizing this. Big thanks to Rich Royce and Rocky Blumenhagen for making this possible. It's a real pleasure and personal honor to introduce Dr. Margot Kushel. I met Dr. Kushel on July 1st, 1995. I remember the day well because it was both of our first days as practicing physicians at UCSF. And over the years, I've seen Dr. Kushel emerge as a national leader, build a phenomenal research program to understand the causes and interventions to ameliorate the harms and prevent homelessness. Dr. Kushel is a professor of medicine at the UCSF in the division and the division chief and director of the UCSF Center for Vulnerable Populations. She's also director of the Benioff Homelessness and Housing Initiative. She's a practicing general internist at Zuckerberg San Francisco General Hospital. And Dr. Kushel's research focuses on the causes and consequences of homelessness and housing instability, with the goal of preventing and ending homelessness and ameliorating the effects of homelessness on health. Her NIH-funded program focuses on aging in the homeless population. She also works closely with government bodies, nonprofits, communities impacted by homelessness to bring forward solutions that center racial and housing justice. She serves as a board member of Housing California and has spoken at local, state, national levels about homelessness. It's a real honor and a pleasure to introduce Dr. Gushell, who will speak about homelessness, housing insecurity, and racism during COVID-19. Dr. Gushell.
Thank you so much, and thank Dr. Zapata for inviting me. Let me do the hardest part of every talk and get it opened up. Wonderful. All right. Thank you so much for coming. I'm Margot Kushel. I use she, her pronouns. And I also welcome you to follow me on Twitter at mkushel, where I often tweet about things related to the topics we're talking about today. Today, I'm going to talk about a pretty broad topic: homelessness, housing insecurity, and racism during
Margot,
COVID-19.
this is David with AV.
Yes.
We're looking at your presenter screen.
Oh dear.
Wondering, it looks like you're probably running two screens, and if you go,
Swap.
I do it. Not
Is
gonna do
that
it. There
better?
we go. You're
Is
doing
that better?
great now.
All right,
Onward.
thank you. I told you that was the hardest part of any talk. All right, so now can you see the correct screen? Okay, so I'm going to talk about homelessness, housing insecurity, and racism during COVID-19. And in this talk, I hope to really perhaps convince you or open up your eyes to the ways that housing and our profound lack of housing justice played a major role in fueling this pandemic, and hopefully to inspire everyone to bring this call to end these practices, not just to end the pandemic, but for our health overall. The COVID-19 pandemic really exposed the effects on racism and health. We saw widespread, and we're continuing to see, disparities and inequities by race and ethnicity, which reflect racism, of course, and not race, because there is no biological meaning to race, but it does serve as a marker for the exposure to racism. This played out in many ways, including the ability or inability to shelter in place, the effects of housing crowding, the effects of congregate settings where racialized and ethnic minority groups are often further exposed through their over-representation in places like nursing homes, particularly those funded by Medicaid, the carceral system, homeless shelters, and it continues to affect access to testing, early intervention, and vaccination. What I like to say, and what I'm going to talk about in this talk, of how the COVID pandemic has exposed what many of us in this field have known for a long time, which is the health impacts of the housing crisis and its disproportionate impact on communities of color. I like to say that homelessness is just the tip of the iceberg. It is the most visible manifestation of our housing crisis. But I think it's also important to note that our housing crisis really sits at the nexus of racial disparities and COVID-19. As the brilliant author and thinker Nicole Hannah-Jones said in a talk that I heard, the North and the West did not require Jim Crow because we had our housing policies to serve that role. I want to remind you that housing problems exist on a continuum. And for every person who's experiencing homelessness, many more are experiencing the risks and the harms of housing injustice and are risks for homelessness or the poor outcomes associated with housing problems. For every person who's homeless, we see so many more struggling with rent burden or severe rent burden, living in overcrowded housing, or facing rental arrears. It's often been said that in LA, which has a very large proportion of people experiencing homelessness in this country and did a wonderful job raising incredible funds and has done through Measures H and HH and has done an incredible job housing people, that for every person they housed, 1.7 more became homeless. And it's really important that when we seek to solve homelessness, we not just focus on those on the visible end of this spectrum, but those right beneath the water, as it were. So why are people homeless? We think about homelessness as an interaction between structural factors, things like racism, the availability of affordable housing, jobs for low-wage workers, income inequality, and individual vulnerabilities, mental health disabilities, substance use disorders, adverse childhood experiences, and the presence or absence of a safety net. Things like income support, safety net healthcare, subsidized housing, homelessness prevention, and the rest. The less favorable the structural factors and availability of the safety net is, the fewer individual vulnerabilities one needs to become homeless. So how are we doing? I think it's fair to say that in a country like ours, where the structural factors are so poor, where racism runs rampant and really serves at the heart of every policy decision in this country, and where our safety net is so frayed, that we are doing poorly. It is thought that approximately 550,000 Americans are homeless on any given night, and this is thought to be an underestimate, but also thought to represent only nightly homelessness. Many more, of course, experience homelessness over the course of a year. Nationwide, about 39% are unsheltered, but those numbers vary widely. In New York, where there's a right to shelter, only 5% are unsheltered, whereas in my state of California, 2/3 who are homeless experience it unsheltered. We know, and we'll talk about this soon, that certain populations are at dramatically increased risk of experiencing homelessness, with people who are Black experiencing a 3 to 4 times elevated risk, and members of the LGBTQ community are at twice as high risk. But I want to remind you that underneath the 550,000 people experiencing homelessness nightly, there are 10.8 million extremely low-income renter households in the United States. So why is homelessness so terrible in the US? Well, let's just talk about a few factors. In the United States right now, there are only 36 units of housing available and affordable for every 100 extremely low-income household. An extremely low-income household is any household that makes less than 30% of the area median income of the area in which they live. And affordable and available means that that unit of housing is available for rent, habitable, not occupied by someone with a higher rent, and affordable by paying 30% or less of that household's income on rent. Oregon is, by my count, the 3rd worst state in the nation on this matter. My state of California comes in 2nd. Oregon has only 25 units of housing that are affordable and available for every 100 extremely low-income household. Perhaps it's no surprise why we see so much homelessness. When we look around the country, households are extraordinarily rent burdened. This is a heat map of the share of households who face cost burdens, which is those who pay 30% or more of their household income on rent. You can see that in much of California, in Oregon, as well as in Florida and the areas around New York, 50% or more of all households are spending more than 30% of their income on rent. It's going to be hard for us to solve homelessness without this. If you're not convinced yet, we have other observational data to suggest the link between housing affordability and homelessness. Homelessness is more common in areas with more expensive housing costs. To the right, you see housing costs going up, and on the vertical axis, you see the rate of homelessness. And it's not just housing costs, but it is the proportion of rent. It's really about income and whether income keeps up with housing costs. In a very interesting observational study done by Zillow, they looked at rent affordability, or the share of income of a median earning household that spends on a medium value rental. They just looked at the median of all rents in the area and the median of all income in the area. As soon as that share hit 32%, you start seeing a dramatic increase in slope of homelessness, such that every time rents go up and outpace income, you can expect to see more homelessness. I want to remind everyone that in this country, housing assistance is not an entitlement. In fact, fewer than 1/4 low-income at-risk households who meet the very strict criteria for rental help receive it. You might have heard about rental help, housing choice vouchers, otherwise known commonly as Section 8, where an individual receives a voucher that allows them to seek housing in the private market and to offer the voucher to pay the difference between 30% of their household income and the cost of the rent. The federal government picks up the rest. You might have heard that many people who really can't afford housing don't meet the strict criteria. And you might have heard that these can be hard to use in high cost areas because of discrimination against Section 8 voucher holders. But disregarding both of those, perhaps the more important point that is less known is that everyone who meets the strict criteria, only 1 in 4 receive it. Unlike something like Medicaid, where if you meet the strict criteria, you receive it. That is not how housing vouchers operate. There is a fixed amount of money to fund them. And in areas like California, you cannot even get on a waiting list for these vouchers because they've been closed for 10 years because the wait is so long. I want to remind everyone that homelessness is a racial injustice issue. In this country, home ownership has been the primary means of wealth building. And I want to remind everyone that until very recently in our history, until the end of the 1960s, there was fully legal, completely unethical and racist, but fully legal discrimination in home ownership, which operated through systems like racial covenants that resulted in segregated neighborhoods, where certain people were unable to, that if you were Black or brown, you could be unable to rent housing in what was called redlined areas, or certain areas where neighbors could have covenants that did not allow you to sell a house to someone who was non-white. The bank stepped in and basically refused to offer mortgages to anyone who is buying a house in any of these quote unquote risky areas, otherwise known as the areas where Black or brown folks were allowed to own housing. This led to widespread segregation in housing that exists until these days, although officially in the late 1960s, fair housing laws made this illegal. Recently, we've seen things like predatory lending expressed through the crisis in 2008, which led to the foreclosure crisis, where Black and brown homeowners were targeted for predatory housing loans, which led to widespread foreclosures. And we see, while it is illegal, widespread and well-documented ongoing discrimination in rental markets, where if 2 people show up to rent an apartment with this same housing resume, listing their qualifications for housing, through secret shoppers, we know that if you show up with the same resume and you are a Black or brown person, you're significantly less likely to be offered that rental unit than someone who is white, therefore leading to Black and brown households paying more for the same quality of housing because they have fewer choices. You add to that the well-known and well-described and ongoing discrimination in the criminal justice system and policing, in the employment system, and in the educational system, where I will remind you that we choose to fund our public schools through local taxes, which still to this day bear the marks of those redlined areas. And perhaps it's no surprise that Black Americans are overrepresented 3 or 4 times in the homeless population. One of the legacies of this discrimination in home ownership is that Black households were left out of the post-World War II boom in home ownership. This discrimination is thought to play a major role in the very wide differences in household wealth between the Black and white communities. Here you see the median net worth in 2019 dollars of white households in this country compared to Black, Latinx, and other households. This lack of wealth plays a major role in fueling the homelessness crisis. We've left with major ethnic and racial disparities in who experiences homelessness. You can see here that Black or African-American households represent 13.4% of the US population, but 39% of those experiencing homelessness. We see an overrepresentation in the Latinx population, in the Native American and the Native Hawaiian and Pacific Islander populations. These disparities play out in Oregon as well, where you can see an overrepresentation of these minoritized populations. Another way to look at it is rates of homelessness by race or ethnicity. Overall, 18 people per 10,000 in America are homeless. But if you look at populations like the Pacific Islander, Black, Native American, and Latinx populations, you see wide increases in chance of homelessness. We see a greater share of Black, Latinx, and Native households are extremely low-income renters, those renters who face enormous cost burdens. And we see that white rental households are least likely to be rent burdened or paying more than 30% of their rent, of their income on rent. But this is what we talk about less. This is what sits underneath that iceberg, which is that Latinx, Asian, and Native households are dramatically overrepresented in crowded housing, or housing where 2 or more people live in every room in a house. We know that Black Americans are 3 times more likely than non-Hispanic white Americans to live in this crowded housing. And I want you to focus for a moment on the disparity in Latinx households living in crowded housing, because this is going to play a major role in COVID. So let's turn to housing, COVID, and racism. I want to take you back to those early moments of the pandemic. And I want to start actually by not talking about homelessness, by talking about the housed population, which has gotten a little less press. I want to take you back to those first few weeks of shutdown, where I, for reasons that are complicated, volunteered in my clinic to call everyone in my clinic who was diagnosed or tested for COVID. I thought this would be a good way to contribute. And for the first 6 to 8 weeks of the pandemic, spent 3 or 4 hours every day calling and talking to everyone in our clinic who had been tested for COVID. If they were infected, I talked to them every day, talked to their household members, and tried to do what I could to keep them safe as we were getting contact tracing and the like set up. Our shutdown in California happened at midnight on March 16th. This is an email that I sent on March 30th, 2020 at 3:56 in the afternoon to several colleagues. Hi, was just looking on our list. This is a list of people testing. All 9 of the folks on our clinic list are patients or folks tested by us who have come back COVID infected or monolingual Spanish speakers. For some context, about 15% of those seen in our clinic are monolingual Spanish speakers. You know if others are seeing this pattern? I could imagine the reasons for this exceedingly high risk of our monolingual Spanish speaking patients, but don't know if we are seeing this throughout our system. Anyone know? I just reviewed my tracking list and 9 of 9 positives are monolingual Spanish speakers. Margot. This is what I didn't say in this email, that as I was doing those calls, I would talk to the person who was infected and in an attempt to do contact tracing, would ask them several questions. And as something of a housing geek who has spent most of my career studying housing and the lack of it in our community, I myself absolutely took my breath away. I would talk to someone who was infected and they would tell me that they were still working outside the home. They were working in McDonald's, they were serving as a janitor, they were doing the really important work that one could not do from home, like so many of the rest of us were. I would start to ask them who else was in the household in an effort to make sure that we were doing appropriate contact tracing. And inevitably, the list would go 10, 12, 14 people. And when I would ask them how many bathrooms and bedrooms were in the house, seeking to see if I could help them isolate safely from home, I would hear that there was 1 to 2 bedrooms or 1 bathroom with 12 or 14 people sharing it. The next day when I would call back, there would be 2 or 3 others in the household with symptoms. And by the 3rd or 4th day, nearly everyone in the household would be infected. We saw pretty quickly nationwide that COVID-19 was disproportionately impacting communities of colors. Here are some ratios, both of cases hospitalization, and death by racial or ethnic identity. And I want you to see how both Native American Indian or Alaska Native non-Hispanic people were at dramatically higher risk of all of these, as were Black, African American, non-Hispanic people, and Hispanic and Latinx. We're all at higher risk both of becoming infected, of being hospitalized, and of dying from this pandemic. We saw that these racial and ethnic disparities in mortalities were apparent across essential worker sectors. So within a sector of people who were serving this role where they could not shelter in place, we still saw disparities. So it wasn't simply a question of who was doing what jobs, but something else. And I'd like to highlight the role that this housing played in perpetuating these differences. In a famous study done by my colleague, Dr. Diane Havler and her team, they looked at one census district in San Francisco in the rapidly gentrifying but historically Latinx community in the Mission. And they found in that neighborhood that Latinx households were at dramatically increased risk. Over the course of a few days, they tested almost 4,000 people in one census district. In the district, 40% identified as Latinx and 41% as white. 2.1% of tests came back COVID positive, except 95% of all of those who were infected were Latinx, despite the fact that only 40% of those living in the district identified as Latino. Latinx residents were disproportionately impacted, and here you can see the point prevalence that they demonstrated. Overall, it was a little over 2, but if you looked in the Latinx population, it was significantly higher, about 4. And if you were white and lived next door to those, to your Latinx neighbors, you had almost no risk of COVID. They called that they showed that if you were Latinx, you had an odds ratio of a 10-fold increased risk of infection. If you had an inability to shelter in place, to maintain income, your risk was elevated by a factor of 3. If you were a frontline service worker, by 2.8. If you were unemployed, you had a dramatically elevated risk. And if your household income was less than $50,000 a year, your risk was elevated by 19. And in their discussion, they said, we suspect that transmission was amplified in Latinx, multi-generational, and multifamily households, a byproduct of skyrocketing rental costs in the city. They knew what I knew, that in households where 12, 14 people were living with 3 to 5 essential workers who were out there every day because they could not afford to stay home and were faced with this terrifying risk that the infection spread like wildfire within the housing. Why were people living 14 to 1 or 2 bedroom apartment? That's because of the crisis in housing costs and lack of affordability. So homelessness, turning back to homelessness and COVID-19. Obviously, we knew at the beginning that people experiencing homelessness would be at an increased risk of contracting respiratory infections. This is a picture of a relatively typical, albeit small, homeless shelter. In many homeless shelters, you'll have beds like this, even bunk beds, with 200 or 300 people living in a poorly ventilated, close space. We knew before the pandemic hit here that homeless individuals would be at increased risk of contracting COVID-19 because of the crowded conditions and the poor ventilation in homeless shelters. We also knew that the population would be at increased risk of poor health outcomes were they to acquire COVID. It is an aging population whose age distribution among single homeless adults is significantly older than the population overall. It is a population with poor underlying health and multiple comorbidities, which place people at poor risk of poor outcomes were they to become infected. And we suspected that people experiencing homelessness would have decreased access to care, such as testing or early treatment. We also knew that separate from their increased risk of hospitalization, of increased risk of contracting the disease and increased risk of doing poorly, that they would have a separate increased risk of hospitalization because they had a higher risk of contracting worse health outcomes and a lack of place for isolation and quarantine, which, absent other interventions, would force us to hospitalize people who otherwise we might have allowed them to shelter in place at home or isolate or quarantine at home. And we knew early on that people experiencing homelessness would likely face barriers to testing and vaccination, as well as increasing lack of ability to get early intervention. This turned out to be true and became obvious right away, as we saw, and these are from 2020, multiple instances across North America of COVID getting into a homeless shelter and spreading like wildfire. If you look in San Francisco, we got COVID into one of our large shelters, and within days, 2/3 of the residents in that shelter were impacted. We saw this enormous transmission that happened very quickly. My group tried to do some modeling to see if there was any way to keep people safe in shelters, and we wound up thinking there likely was not. We modeled the probability of averting an outbreak in either moderate risk meaning moderate community spread with an R0 or transmissibility of 2.9, which is what the initial COVID numbers look like, or in a high risk of transmission, which is what Delta actually looks like now, where one infected person would likely spread it to 6 others. We looked at the effect of daily symptom screening, which had almost no impact on decreasing the probability of an outbreak. We looked at twice weekly PCR testing alone. This was before rapid tests came out. Likewise, even that highly costly intervention would only reduce the risk in a moderate risk transmission by 0.2, and in a high risk would have almost no impact. We looked at universal mask wearing, relocation of high-risk individuals, and a combination strategy if someone could manage to do all of these things, which no shelter basically had the funds to do, could in the regular COVID decrease the risk of an outbreak by a measly 42%. And in an experience like Delta, where transmission rates are higher, decrease it by only a probability of 0.19, meaning that in these environments, absent vaccination, there's almost no chance of averting an outbreak. So what did we do, and what do we see in this sort of dismal experience? I want to talk a little bit about some things that were done, some innovations that happened, and I want to talk about things that give me hope that we could learn from this, that we could do things a different way, and the things that keep me up at night when I'm feeling less optimistic. In the first few days of the pandemic, I was invited or asked to go to Sacramento to work for the governor's office in the Emergency Operations Center. Looking back, it is almost hilarious. There we all were, crammed into a room, maskless, working furiously 14 to 18 hours a day, trying to do something for the pandemic. I was asked to come up and work with a small group of people who were trying to figure out what to do in the setting of this pandemic for people experiencing homelessness. We sat on a whiteboard and laid out some guiding principles. Our principles were, we realized we needed to save lives. We wanted to protect people who are experiencing homelessness from becoming infected. And we knew then that our hospitals could easily become overwhelmed, and we wanted to protect the entire community by reducing hospitalizations or flattening the curve and reducing the risk that large groups of people would require hospitalizations where we could prevent it. This graph is almost ridiculously naive. This was done in the first week of shutdown in my scribbled hand, and then we put it onto a PowerPoint slide where we were trying to come up with a mechanism for doing something different. And we came up with this idea where we wanted to decant the people who are at highest risk of dying from COVID or requiring hospitalization and remove them from congregate settings as quickly as we could. And we wanted to separately provide a means to provide both isolation and quarantine, or the ability to stay by yourself if you were infected and did not require hospitalization, or stay by yourself if you were exposed and could be infected and did not require hospitalization to decrease risk of infecting others and to allow for care and to decrease risk of overwhelming the hospitals. In those first few days, we came up with something that we called Project Room Key, where we called around to hotels which were suddenly emptied because tourism had collapsed and began to ask to rent large numbers of hotel rooms for this purpose. We called college campuses which had dorms, particularly those with single bathrooms who were not being used for college students who were now at home. And we asked for as many FEMA trailers as we could get. To do so, we wanted to do two things: provide long-term non-congregate shelter for those at highest risk. We would have loved to include everyone, but we quickly figured that we were going to need to triage and did not have enough rooms for the 160,000 people who experience homelessness nightly in California. We wanted to provide short-term isolation and quarantine for those who required isolation and quarantine. We did something that had never been done before, which is that we approached FEMA and asked for reimbursement, seeing COVID as a massive, almost natural disaster, and asking for use for funds for people who experience homelessness. Something I had not realized until those few heady days is that normally in natural disasters, FEMA does not provide services for people who are homeless because their trailers and otherwise are used to replace housing. And if you're homeless, you have no need to replace your housing. We applied for and received FEMA reimbursement initially for 75% of most of the costs of these. And when the Biden administration came, they actually lifted it to 100%. We wanted to provide single occupancy shelter, and we worked quickly to pull together collaborations. We realized that this would take more than a village. With state funding, FEMA funding, local funding, the collaboration of health departments, local federally qualified health centers, emergency operation units, and nonprofits gathered together in the course of days to bring on board 20 to 25,000 of these rooms. We have done some research on the isolation and quarantine parts of this, where we basically brought in people from surveillance and field testing, from homeless service providers and shelters who were pulling out people who either tested positive or were exposed to it or had symptoms, hospitals and community providers where people someone showed up in an emergency department and either was exposed or infected, could be sent there, and all other sources. We sent them to these through a centralized referral process to these hotel rooms where there was health services for daily wellness checks. We did harm reduction services, daily symptom screening. We provided food and laundry because we obviously didn't want people leaving their rooms, discharge planning, and the like. And in our research, we showed that this rapid operation dramatically decreased reliance on hospitalizations without poor outcomes. And the vast majority of people sent there did not require hospitalization and were able to complete their isolation and quarantine. We have seen numerous positive impacts from Project Room Key. First and foremost, perhaps, it has been a proof of concept that we could quickly bring online 25,000 units. We could get collaboration from health departments, healthcare providers, and nonprofits, as well as people impacted by homelessness. These units in California and Washington, where the most research has been done, have shown to decrease COVID transmission and decreasing furthermore the morbidity of those in shelters, because we were able to pull out of shelters those at highest risk of hospitalization or death and decrease the total number of people in the shelters. We were able to support the hotel industry, and this is a good example of a win-win with the business community because those hotels were facing financial ruin. We developed partnerships where partners had not existed before, and we were able to very quickly and quietly bring dramatic harm reduction services online. In California, we offered people in Project Room Key alcohol on an harm reduction basis to keep people from going into withdrawal. And we offered people, even somewhat more controversially, cigarettes and marijuana in the hopes that that would keep them from leaving their units. We develop partnerships where partners hadn't been before, and we have signals in work that I'm currently doing that show that those who were sent to Project Roomkey compared to similarly matched people who were not chosen had decreased ED use for all causes and decreased hospitalizations. And in some jurisdictions, many of the folks brought into Project Roomkey were then transitioned to permanent housing. California was so excited by the success of Project Roomkey that they chose to use CARES Act funding, or the large amount of federal dollars that came through in the COVID response, to rapidly purchase motels, hotels, and other dorms and other things to transition them to permanent housing. In the first round of funding, they funded 6,000 units of housing. They are now currently entering round 2. From the time of application to move in was 3 months or less. In a state where it often takes us 10 years to develop housing, this has been an enormous innovation. This speed, which was a part of the requirement, communities could only get this funding if they acted quickly, decreased the ability for communities to oppose the transition of these buildings for use for extremely low-income housing. However, now in our current round, communities have caught on, and we're seeing more opposition. In an area of San Francisco, which has very few services for indigent people, someone actually said to one of our newspaper reporters last week, "We're in support of permanent supportive housing. We just are not in support in our neighborhood." We felt that this has shown a proof of concept that not all ELI housing needs to be built from scratch. And we've shown that it can be done at a dramatically lower cost and an estimated $160,000 per unit compared to our usual costs in California of $650,000. We saw other things happen that were unusual. We saw the CDC create an eviction moratorium in September 2020, recognizing that so many people were behind in their rent and that placing people into the streets and into homeless shelters would be calamitous. Many state and local governments layered on moratoria on top of the CDC's. These moratoria made it illegal to evict for non-payment of rent if that non-payment was due to COVID-related disruptions. However, people could and are still being evicted for other reasons. People were required to pay back the back rent. Right now, many states, local governments, and the federal government have much money available for emergency rental assistance programs meant to try to correct this hole or to pay back the thousands of dollars of back rent. But we are seeing all across the country, local and state governments struggling to push this money out the door. The CDC moratorium, as you're probably aware, was recently overturned by our Supreme Court. It was replaced with a temporary federal ban by the Biden administration for any area with substantial or high risk spread until October 3rd. And many states and local governments have tried to extend that. There is, however, a potential for an enormous eviction wave. During COVID, and I know my time is up, but I will be done soon, there has been this dramatic need for rental relief. 14% of renters were behind in rent in March 2021, and the federal government is helping to pay back rent. I'm going to skip talking about some experiences we had vaccinating people experiencing homelessness in the interest of time. And just get to my conclusions. I think we are at a moment of inflection here. We have learned the tremendous costs of our failures in housing equity. They have played out in many, many harmful ways to harm individuals and communities and extend the pandemic. It has been a bitter reminder that housing justice is racial justice, and we have neither in our country. The COVID-19 pandemic has exposed vulnerabilities due to racism and the vulnerabilities from our housing crisis and the intersection. The innovations in this crisis has demonstrated that we can act when we do have political will, and that innovations work better when led by those in impacted populations. But the pandemic has exposed the risk of our status quo. with shelters, housing crowding, and housing cost burdens. This is a grave moment of both opportunity, with federal dollars never before seen flowing in to the housing crisis, with our federal government actually talking about expanding housing choice vouchers to all who need, and a moment where we've never spoken so much about the need for housing justice. But it also represents a moment of true crisis. If we don't get this right, what we've seen before will be minor compared to what we will see if the eviction crisis that we most fear comes to bear when that ban on evictions ends soon. And I want to remind you all that we've seen so well throughout this pandemic that there is no medicine as powerful as housing, and invite you all to join me in advocating for an end to the housing crisis in the name of public health. And with that, I will stop and take questions.
Great. Thank you so much, Dr. Kushel. What an amazing keynote. Before we get into questions, we do have a few minutes where we're just going to kind of reground folks. If I can ask our amazing AV team to please put up the session guiding prompt slide. I wanted to remind folks of just a few things, and then we've got a full 10 minutes for Q&A. In this space, we're really hoping to cultivate a framework that's grounded in popular education methodology. We're all teachers and learners. There are clearly folks in this space who have a lot of experience, a lot of lived experience, professional experience, and combined in doing the work that they do. We also want to ensure that this feels like a space where people can ask the questions that are coming to them without thinking, is this a question that should be asked here? Maybe somebody else knows the answer. Our hope is really to have this be as interactive as possible because we're all learning from each other. And then one of the things that we wanted to ask folks to keep in mind as you're asking your questions is really to make sure that we're in alignment with the theme for the day. So as we're thinking about questions and we're thinking about these incredible presentations that are, clearly deeply connected to the impacts of housing insecurity, COVID-19, racial and ethnic equity, is that if folks could use this kind of session guiding prompt, it would be really helpful as we poll questions so that we can ensure that those questions are in alignment with the guiding prompt. So we can also drop that in the chat. We just up on screen, we'll put it, go ahead and put it in there. Thank you. And then the last reminder is please put any of your questions in the chat. All questions are good questions. We're all learning from each other. And so we want to make sure that the questions get into the chat. Katie has a prompt for us, and then we'll move into the Q&A.
Yeah, so thank you again, Dr. Kushel. I know we're excited for the Q&A, but before we do that, I want everyone to look around you, grab a piece of paper, a pen, or pull up a little notes bar on your computer. And we're just going to I'm going to set the timer for 30 seconds, but this is kind of a moment just to reflect on what we just heard through that keynote. When thinking about the theme of the day, when we think about what we heard and what we just heard, what are some of your growth edges when it comes to this work? And by growth edges, we mean kind of areas of learning that you see within your own work or within your community. So I will pause for 30 seconds and then ask folks to share as they feel comfortable in the chat. Okay, do we have a couple volunteers to just share with us what kind of came up for you around your own growth edges in this work? We may have a shy crowd. That's all right. You'll have a chance to talk with each other in a little bit. Okay, I see. For our state, we lack the data to do the type of analysis we saw today. Definitely an area for growth. Okay, thank you, y'all. So we're going to move into some Q&A for our keynote.
All right. So, Dr. Kushel, we have a number of questions that have come in. There was a question that was asked about the effectiveness of PRK in moving clients into stable housing. Has it been evaluated? What does the data show? Can we start there, please?
Sure, it's just starting to be evaluated, and I would say that there was wide differences in communities. In some ways, there was a little bit of this spurred by Project Home Key, which was the follow-up, but they were only 6,000 units built for that. So some people were moved into that permanency. In fact, some whole hotels or motels that were in Project Room Key were converted to permanent. I would say that there were some communities that were able to effectively use things like CARES Act rental assistance, or in San Francisco, where we have our own local homelessness funding that passed recently that provided an opportunity to offer basically permanent housing to everyone brought into Project Room Key. But there were other communities that really didn't do this, and where the Project Room Key was slated to shut down before Delta came, and they have not been able to pivot to keep it open. And there's been some controversy. I think I would like to mention, though, that there was some controversy overall because the criteria used for Project Room Key differed from what has traditionally been used in the coordinated entry process. And there was some concern that people were sort of jumping the line. It just shows the challenges that we have in such a region of scarcity. But I will say in certain communities, there have been tremendous rates of permanent housing from people brought in to Project Room Key, and that's been really exciting and an example I hope we could continue in other places.
Thank you, Dr. Kushel. To build on that, there was a question that came in about the possibilities of Project Room Key in the future. Do you have thoughts? I know you touched a little bit on, some of the projects perhaps having to shut down, but do you have thoughts about the future of projects such as Project Room Key?
I think I'm torn. I have always, as a physician, actually been very concerned about the use of congregate shelter, and I think that that we've really seen that in COVID. But the guiding principles hold true. I've actually very quietly been opposed to enacting a right to shelter law in California like that in New York, because homeless shelters are extraordinarily expensive. They create often poor outcomes. They can be violent places. They can be places of great transmission for many types of illnesses, and they're really not places of health and healing. The other thing that they do is take people out of sight and out of mind. And so what we hear often, people talking about mandatory shelter, we hear we're in the midst of a recall election in California where there's a lot of the candidates for the recall want to build big warehouses and enforce that everybody go into shelter. And what we hear from people experiencing homelessness left and right is they have a very good reason to not want to go into shelter. I think Project Room Key presents us with this thought of could we rethink shelter to be something that is, one, very short term, but two, single occupancy, which could really create more health and healing. I will say on the flip side of that, they have been extraordinarily expensive as done currently, with costs of up to $250 or $300 per night. Part of those costs are because of the need for a lot of health and a lot of things that were done because of COVID, 3 meals a day delivered, et cetera. But I do think that there's a lot of talk in California and otherwise is whether we should move away from congregate shelter and move to a model of emergency shelter being single occupancy. It would be expensive, but it may be the way to go.
Thank you for that, Dr. Kushel. There's an additional question about the project turnkey, prioritizing medical vulnerabilities. Do you see this perpetuating racial inequities in access to permanent housing?
So I have been a big critic of the way coordinated entry currently works. If people know coordinated entry, that is a system mandated by HUD where people are prioritized for the scarce resource of housing. And most coordinated entry programs really prioritize certain things like behavioral disabilities, like substance use disorders and mental health disorders, get you a lot of points. This system, any system that prioritizes individual vulnerabilities rather than structural vulnerabilities, is likely to disproportionately lead to housing options for white folks, because white folks face many fewer structural vulnerabilities to homelessness. The chance that they are homeless on the basis of individual vulnerabilities is higher. And this has led to this skewing where if you are homeless and white, you are more likely to score high on coordinated entry. In some ways, Project Room Key prioritization got around that a little bit by prioritizing certain health conditions rather than behavioral health conditions that were more prevalent could be more prevalent in non-white populations, although it did not solve it. I have been a major proponent of trying to rethink how we do coordinated entry to go beyond listing a series of individual vulnerabilities and to move into ways to do structural vulnerabilities. One of the insidious effects of racism is that people have basically weaponized fair housing laws, which were meant to like sort of decrease the effect of white supremacy in housing. But of course, as always happens, it had become weaponized where you are now not allowed to let's say, use race. You are not allowed to say that if you are Black or Indigenous or Latinx, you get extra points, even though we well know that those populations face so many more risks of homelessness. Places are trying to think of ways to get around this by using markers of exposure to racism, such as if your last housing was in a formerly redlined census tract, could we use that? Because frankly, housing is so segregated that is a marker for that risk. Could you use things like involvement with police or criminal justice system? Again, those in our society are almost markers for exposure to racism. But I am so glad someone brought up this point because I have been and am a very big critic of the use of individual vulnerabilities because I think that will lead to disproportionate opportunities for white folks and a decreased opportunity for those exposed to racism.
Wonderful, incredibly important points that you're making, Dr. Kushel. I'm wondering if we can talk a little bit about resource reallocation. So I'm wondering what opportunities for systems change, like resource reallocation to support people experiencing homelessness, do you think we should be considering? You know, we talk a lot about how much things cost, and I just wonder from a public policy or a systems change perspective, if you have thoughts there.
Yeah, I think it's, there has been a lot of temptation, for instance, in the permanent supportive housing literature to talk about permanent supportive housing saves healthcare dollars. And I think that's a misleading frame because we know that people, let's say, experiencing chronic homelessness do use a lot of emergency department care, but they're also very under-resourced, right? They're not getting valuable healthcare services. And so when people get housed, actually their healthcare costs may not go down, but we get better healthcare quality. On the flip side, it is absolutely astonishing the amount of money that we spend managing homelessness. When I was working right before Christmas, the state testing task force helped me to help them use this new technology, rapid testing, and figure out how to use them in shelters. And we set up a rapid testing program in our shelters. And in our shelters, which had been de-intensified, there was almost a 1-to-1 ratio between staff and guests. And here we were, we were spending this massive amount of money to test everyone and all these nurses. And there was part of me saying oh my God, why don't we just take this and pay rent for people, And so I think that we need to get beyond the very narrow thinking of will this prevent ED visits? Because, ED costs are fixed and people are underserved. And we don't, for white people, we do not view healthcare costs as bad. We just say, can you get a good quality? We don't ask people to save money with their healthcare costs. But I do think we need to start reframing the debate of how much it costs us as a society, whether those be environmental costs of people commuting 2 or 3 hours to work, whether that be the cost of having 14 people in a 1-bedroom apartment where, we have seen all of these costs on educational outcomes, on health outcomes or whatever. I think we need to start talking about housing as infrastructure. Housing is one of the most basic needs in our society, and we talk about it as like it's a privilege. We don't talk about having like highways like that, right? We need to talk about it, and we need to talk about fixing this historical injustice in housing through spending. So I hope this pandemic and the fact that we've been unable to get control of it has so much to do with our bad housing policies can be a moment of opportunity for advocating.
Yes, thank you so much for that. There was one more question here. It says, you mentioned that there's been a struggle to get emergency rent assistance out the door. What role should community-centered approaches play in this?
Yeah, I mean, I think they need to play everything. When you look at what you need to do to get this money out the door, people often need internet access. They need to have a fair amount of knowledge. We've just done work in 500 families who should receive earned income tax credit. These are mostly young families of color. And not only we've seen very low receipt of earned income tax credits for which they qualify, but very, very low receipt of rental assistance. And we're seeing that play out all over. In our vaccine efforts, we set up vaccine programs, and we basically hired a group of people with lived expertise of homelessness, and I put them in charge. And basically said, we, the healthcare providers, are following your lead. We'll answer any questions you have. We brought the vaccines, but you are in charge. And it worked incredibly. You know, we said, we have your back. We're right here to answer any questions. We've got the healthcare knowledge, but you guys are in charge, and it worked. We need to start thinking that way. We can't have top-down approaches. I think we need to put that money the closest to the community we can go. And we, particularly those of us who benefit from white supremacy and we who have expertise, need to take a step back. We need to provide the resources and the expertise, but I think we need to have communities themselves lead these efforts. To be honest, I think we would see a lot more money being pushed out the door. And someone is asking questions only to me, so I don't think others can see what is the cost for housing vouchers. By the way, it's been estimated to be about a $60 to $70 billion spend to increase annual spend to increase the housing vouchers to give it to everyone who deserves it. I want to put that in context. We currently spend about $30 billion a year in shelter costs. And as you can see, 39% of those experiencing homelessness are sheltered. So most people are unsheltered. Most people, many people don't even receive shelters, and we spend almost that amount of money on shelters itself. The cost sounds like a lot of money, but for the federal government, it's around $1 million. Sorry, someone just keeps asking me if I want to get to that.
Thank you, Dr. Kushel, for sharing the questions that came to you. And I just really appreciate your responses, all the work that you've done, the questions that we were able to get answered here. I think it's you touched on incredibly important points, and I hope folks are really thinking about some of the things that you said in ways in which they can potentially shift or grow their work based on the things that they've heard today. So thank you very much for everyone. We are going to go ahead and head to break. We will be back at 10. Yeah, absolutely. Oh my gosh. Thank you so much for being here. We will be back at 10:25. So if folks want to just take a quick stretch break, bio break, whatever you need to do, we'll see you back in about 4 minutes. Thanks again, Dr. Kushel.
now pass it over to Dr. Zapata, who will introduce us to the introducer of the keynote speaker.
Thank you. At PSU, we love to have like 50 layers of introducers, but I actually decided to change up PSU protocol a bit and invite President Percy to come and introduce Dr. Crutchfield today. President Percy would usually have done the welcome, but we were honored to have somebody, Shannon from the governor's office, join us. And I thought it was a great opportunity for President Percy to connect the work that we're doing here on campus with Dr. Crutchfield's research and work for around the country. President Percy, you here? Thank you. President Percy is obviously the PSU president, but I really want to just say he was also my dean for a lot of years and a wonderful mentor. And more importantly, really stepped into leadership at the university at a particularly tumultuous time. And I think has just really provided such an important role in helping us move forward and to set the framework for the next few years. President Percy.
Thank you for inviting me, Dr. Zapata, and thank you all for being part of this really important conversation. The work of our Homelessness Research and Action Collaborative is so important, and it is so valuable both to our own campus and our community. And the work that all of the folks are doing is just amazing and wonderful. And thank you for all sharing time together today to think about these important issues. We know that homelessness and housing insecurity is part of the college experience for far too many students. Last year, when we saw the results of the HRAC collaborative survey, we understood just how many students struggle with stable housing and enough food to eat. More than 60% of our student body faces basic needs insecurity, and that number is even higher for students of color. These figures are pre-pandemic, so we know the gap is probably much wider now. This is something we really need to pay attention to. This fall, the university will launch a basic needs hub where students can access resources, including securing food and finding housing at one location on campus. It's not enough, but putting it in a place that's more visible and more centralized hopefully will allow more students to find that resource place. We know that we need to do more, and we will, and we're thinking about a variety of other alternatives trying to help the basic needs of our students. I am honored to introduce our afternoon keynote speaker, who is one of the first researchers to sound the alarm on basic student needs and the insecurity that students face. Her work set the foundation for the research that followed. Dr. Rashida Crutchfield is the executive director for the newly created Center for Equitable Higher Education at California State University. She's also on the board of the PSU's Homelessness Research and Action Collaborative. We're so honored to have her with us today to talk about the impact of COVID-19 on student basic needs insecurity, in particular the impacts of students of color. We're so glad to have you. Welcome, Dr. Crutchfield.
Thank you so much, Dr. Percy, or President Percy, and to everyone for being here in this virtual space together. I know we likely have been sitting for quite a long time, so if you need to do some chair aerobics, please do, and also nurture yourselves in any way you need to be. There's probably been also a fair amount of multitasking, because I know I've been in a Zoom meeting or two in the last year and a half, and I just appreciate your time and attention. The conversations we've been having today have been so rich, and I'm really pleased and honored to be a part of this process with you. Before I jump in and talk about the work that we've done in the California State University system and the research that we've done and how it's transformed many of the things we do in higher education, I want to give you a little context. Again, I'm Rashida Crutchfield. I use she, her pronouns. And prior to what I thought would be selling out and going into academia, I was a social worker, and I was a community-based social worker and an organizer. And I was working at Covenant House, California, which is a shelter for homeless youth 18 to 24. And Covenant House is a national organization, but I was working here in Hollywood, California. And at the time, a number of our residents in the shelter were going to colleges, usually community colleges, sometimes four-year institutions. And I was really interested in their experiences and what was happening. And that interest was really triggered by, we had a resident, and I will call her Keisha. Keisha was going to a community college nearby, and she was getting ready to start her semester. She went into the financial aid office to discuss the process, and the financial aid administrator, and this would have been in 2007, thereabouts, told her that she needed her parents' tax forms, which is pretty typical because we know that financial aid is determined often for folks who are younger than 24 by their parents' tax forms. And Keisha said, you know, I'm homeless and I don't have access to my parents' tax forms. And the financial aid advisor told her that she didn't look homeless and that she probably was just fighting with her parents and she needed to go back to her parents, get those tax forms, but she would not be able to come back to school for at least another semester. And Keisha came back to our shelter and discussed this with a group of staff, including Sister Margaret Farrell, who is a staff member at Covenant House, California. And Sister Margaret is a very feisty Irish nun. And I don't know if any of you have been to Catholic school, but you'll know that they have special techniques of coercion. So she went up to the financial aid office and really advocated for Keisha in ways that are reminiscent of my Black mother. And Keisha was invited to come to school, and they sorted out her financial aid forms. But I started to wonder, so what happens for our students who are experiencing homelessness, who don't have a feisty Irish nun to go wreak havoc up in their institutions? And so I started looking for research on homelessness and higher education, and I didn't find any. And so I started reaching out to advocacy organizations like Schoolhouse Connect and the National Association for the Education of Homeless Children and Youth, asking them, like, where's the research? I'm really interested and I can't find it. And what they said to me was, there is none. And my colleague, Barbara Duffield with Schoolhouse Connect, I still have the email. She said, there is no research on this. That's your job now. And it has been ever since. And so since then, my research has really been focused on homelessness in higher education, and definitely also expanding to think about basic needs in a more all-encompassing way. Higher ed for a lot of us is what research has told us is one of the best drivers of social and economic mobility. But as we say that, the narrative of that driver is far more complex for a lot of our students. Higher education, and I'm going to share my screen as I shift into the business at hand. Higher education really has had some interesting responses to this. And I really, before I was doing this research, or when I first started doing this research and was reaching out to institutions to see what they were doing, some of them in the CSU, and I'll talk about that in a moment, had, maybe 3 or 4 of our campuses had some burgeoning programs that people were piecing together. Most institutions had very fractured responses. So students often would be forwarded to their dean of students, who would then catch as catch can. Or I found lots of faculty or staff who would have food in their desk drawers or would give money or food haphazardly as best as they could to the students that appeared. I've also definitely seen folks in higher education who respond to hearing about basic needs insecurity for our students, like I would liken it to stages of grief and loss. And even grief and loss researchers will say the stages of grief and loss have grown and changed. But I still think about it in this way. A lot of folks start out with denial, that our students don't have that, or we, again, don't see students on campus that have these problems, really much framed in our stereotypes about what homelessness looks like, feels like, how it manifests in communities. I definitely have had administrators who really found themselves angry that this has been amplified and raised because, well, for a variety of reasons. A lot of our higher ed folks are doing a lot of really amazing work and wearing many hats with limited resources. They're navigating sometimes or deflecting, saying, I specifically have heard someone say, we are not a social service agency. And deflecting or bargaining to have our community-based organizations really do the heavy lifting. And yet, if our mission is focused on student success, we have to acknowledge that basic needs is a part of that student success. But a lot of us have reached, some of us, not enough of us, but many of us have reached acceptance and are thinking about what we need to do for our students. As I said, I often talk about basic needs security, and the research that we've done really helps us to think about basic needs as food and housing, but also the physical and mental health and well-being of our students, as well as their financial stability. And that can be all encompassing. Really, our students need hygiene supplies. I've listened to students tell me about how they manage their hygiene on campus when they don't have a place to shower. They need transportation. Many of our students are parents and need childcare and employment. All of these components really, if they're placed and secured for our students, means that they can access and grow in our educational institutions. So as mentioned by our colleagues from DePaul, we use an expansive definition for homelessness in higher ed. And I want to pinpoint that we go beyond the HUD definition of homelessness, in part because this is also how homelessness is measured in the K-12 system. Our K-12 colleagues have long known that if our students or our children are experiencing homelessness or instability, including moving from place to place or living in motels, beyond the HUD definitions, then that mobility then translates, one, into trauma, and two, into barriers to their success in the classroom. And so higher ed is catching up. People who've heard me speak before will say that higher ed discovered homelessness like Columbus discovered America. It's not new. This is not news. And yet we are in this emerging awareness of homelessness amongst our students. So I want, throughout this, you will hear from students that I've spoken with in qualitative data collection. For some of this might be triggering for folks. So I want folks to be sure to take care of themselves as those voices come in.
Friends' couches, a couple nights in my car. Thankfully, it was warm enough to where I'm not freezing to death But when I stayed at a certain friend's house and her roommate was kind of getting annoyed that I was there, I didn't want to overstay my welcome. And I had left that day before showering. And so it really hit me like I don't have a place to shower. Something I would never want to wish upon anybody to go through.
So Elizabeth, at Fresno State University, really, there's a lot to unpack here, but what I'll flag for us right now is that some of our students have experienced homelessness prior to higher ed, but many of them are experiencing homelessness for the first time when they come to college. For Elizabeth, she had her financial aid set, and then she had a small savings that was going to support her way through college. but she had a number of challenges. She had some health challenges and then a car breakdown that put her into homelessness. Many of our students who are experiencing homelessness don't label themselves as homeless. I have heard a number of students say, I have a car, that's my home, I'm not homeless. And so we in higher ed have to be really careful about how we label students. You know, for us in higher ed, again, we often have not thought about this need. And then also our students often fall outside of what community-based agencies service populations are considered. So our students have been falling through the cracks as our higher ed institutions have often referred students out, and then those students have found themselves ineligible for community-based services. So the CSU study. So the CSU, for context, is 23 campuses from north to south in California. We have more than 480,000 students and universities and institutions in urban, suburban, and rural communities. And we did a 3-phase study. So I was commissioned by our chancellor, Timothy White, to look at food security and housing security for our students. In phase 1, we interviewed and did some quantitative data with our staff, faculty, and administrators, and preliminary student data to really understand what people thought about whether or not this existed, right? In phase 2, we did a survey across all of our 23 campuses and did interviews and focus groups at 11 of our campuses. In phase 3, we did a meta-analysis of our phase 2 data, really focusing in on how students access on and off campus services, how they utilize their time and their financial resources. In that phase 2 study, we found that almost 42% of our CSU students were food insecure, which is not so dissimilar to our PSU students who were at 44% food insecurity. For homelessness, we found in the CSU that almost 11% of our students had experienced homelessness within the last 12 months. And actually the PSU number is at 16%, about 16% is very close to my own institution at CSULB or CSU Long Beach. I think in some ways it's important for us, these numbers were startling for a lot of people. Very startling for a lot of people. For some people, it confirmed their narrative of the starving student narrative. So sometimes when I would speak or engage with the press around this issue, when I engage with the press on this issue, I try real hard when those stories come out not to read the comments, because I have found that reading the comments will ruin your whole day. But occasionally when I do read those comments where I'm speaking with people, often people will say things like, well, I wasn't rich when I was in college. I, ate ramen noodles and I struggled, and that's a part of the college life. And I think even for some folks who attended college more recently than I did and before, I think people are not thinking about the actual cost of higher ed. I think for our very low income students, our Pell eligible students in the CSU, their tuition at times is paid for, but the cost of living, the cost of having a home and eating is far outstrips our financial aid. And so we really get to think about how we reframe the starving student narrative. It's important, as my colleagues have discussed earlier, to pinpoint and flag that people of color are at higher incidences for food and housing insecurity and homelessness, particularly our current or former foster youth, our LGBTQI family, particularly high for our Black and Indigenous folks, particularly our first generation folks. I know I had a job when I was in school, and also in those comments, people will say things like, well, these students need to go get a job. And so I have lots of really fun things to say about that. But we asked the students, like, how are you using their time? And we found that students who had the highest basic needs insecurity were the most likely to work paid hours. So a lot of our students who are food insecure and homeless have sometimes one, sometimes two, sometimes three jobs on top of the work that they're doing in their studies. And this really pinpoints the fact that students are doing generally everything that they need to do to accomplish this task of graduating from their institutions of learning, and that it points to us as higher ed institutions and our communities of care to respond to their needs.
Despite of all, I'm still happy, and I'm grateful to being able to pursue an education. I know a lot of people can't or haven't been able to. As hard as it is, just the fact that I can eat, I can still come to college or get some kind of degree. That's still a win-win for me.
So a couple of things come up for me when I hear Nancy talk about her experience as a student who's experienced homelessness. Often our students approach their experiences with a lot of grace. And despite the fact that I'm originally from Pittsburgh, I'm sort of typically Californian in that I have this desire for positive thinking. But maybe my roots take hold when I get annoyed that I feel like many of our students feel like they have to be positive, that they have to sort of look at their lives, even though they're hard, with rose-colored glasses. The students, we found in our research that students who experience these challenges the most often are also the most hesitant to seek support. And when they do, they often wait until things are as bad as they can possibly be before they come to us to ask for help. And they may or may not show up with their essential charm. And in higher ed, often we want our students to show up charming. But our responses to care on campuses really has to be trauma informed, and understand that if students come in hot, that is a completely appropriate response to struggle, and that we have to accept them and receive them as they show. Here's Greg.
In a word, fear. At my age, I'm 42. I have about 25 years left before retirement. If I retire from this job, I'll be one of many elderly who's impoverished, who's unable to effectively care for themselves, and who's unable to simply achieve the necessary things of life. For me, I very much feel I'm in a do or die situation. The goal is to achieve as much as possible academically so that I can achieve something more professionally.
So sometimes we'll say things like, life gets in the way of learning, but really, for us, in higher ed, and also, as we engage in community-based organizations, we have to think, well, no, life is fundamental to learning. It's a part of all of what this means for us. In higher ed and beyond, we often are guilty of thinking still about the traditional student. And the traditional student historically has been the student who's 18, coming straight from high school, who's fully supported by their parents, and maybe parties a little too hard and therefore has to have ramen noodles because they don't know yet how to manage their money. But reality is that across the nation, almost half of our students are what I like to call our new traditional students. They are old, over the age of 24. They often have children and or may be supporting their parents or providing for their parents. Often they're working, they may have a disability, they may be the first in their family to attend college. and are sometimes not at all financially supported by their family, but in fact are contributing to the income and financial and social and familial support of their family. And so really recognize this new traditional student helps us unravel some of our thinking around higher ed and really refocus on where we need to be going. So in July of 2020, my colleague Jennifer McGuire and I did research on COVID and basic needs insecurity. And our findings were not dissimilar from our colleagues that you heard from just before lunch. We reached out to students who had previously accessed basic needs supports on their campus at 4 California State University institutions. And of those, a third of them had lost their jobs related to the pandemic. A lot of our students talked about increased anxiety and instability, changes to what people SNAP, or what people colloquially call food stamps, was supportive. So a lot of students who couldn't get SNAP before, what we call CalFresh in California, were able to get SNAP benefits. But a lot of them talked about having high unemployment. Others talked about being essential workers and being most at risk and not being able to not go to work because they were holding all of their financial resources in their own hands and for their families. So for us, we definitely found that homelessness went up for most racial groups, particularly for our Indigenous, Asian, Black, Latinx, and white family. And I won't go deeply into this because I think Patricia really, gave us some really good pinpoints here in thinking about this, but I will talk about this in a moment. So here, Cosmo, and the students, give themselves their own pseudonyms, so please don't blame me for that. But Cosmo said, at the beginning of COVID, I lived off campus and all my roommates lost their jobs. They all left and we left too. So they weren't evicted, but these students who weren't on the lease ended up homeless. And in this case, he was homeless for about a month, moving from place to place. Our students and our campuses definitely responded quickly, some more than others. Some of our campuses were able to scramble and put students in emergency housing on campus. Others closed down completely. So there was definitely a wide range of support. But for a lot of our students who experienced homelessness, they were couch surfing. But couch surfing in a pandemic was not realistic. Moving from place to place was not realistic. So a lot of those students either ended up homeless and living on their street, or going back to situations that weren't necessarily safe for them. Like, we had a number of students who were former foster youth who went back to their families because they didn't have any other choices. We know that our institutions often become anchors for our students. So our students often access most of their services on our campuses versus community-based services. Also, our students often, if they're experiencing homelessness, stay on our campus all day long. So they may come to campus as soon as it opens, stay all day into the evening, and then leave because it is the most supportive place they can find. So Yvette at CSU Los Angeles said, I think just school is the one thing that kept me up. I feel like I would have gotten depressed or something without it. So it's really important for us to think about what that means for our students. In this case, it meant a few things. When students had the ability to access services, they did. But what we found was students' participation in basic needs services dropped dramatically in COVID, in part because our campuses had to negotiate. So many campuses either shut down or had to go to curbside assistance. For others, a lot of our students are commuter students, so they may have moved out of the area and didn't feel like they could access those services. I'm going to move forward.
saving money for my kids so they don't have to go through this. Unfortunately, I can't change anything about my situation, but hopefully I can change the pattern for the future.
So I think for many of us, we really have to understand that as higher education was developed in its original purpose, it really was to meet the needs of those who already had access to privilege. You know, colleges and universities really were centers for the children of the wealthy and the white wealthy. And many of those ideologies still move forward through higher education. The essential recipe for higher education replicates inequality sometimes. As you know, as our students who are low income go deeper into debt, their economic mobility is dampened by that. And so if we're really going to have eyes on justice, we have to use ingredients for higher education to make a different kind of stew. And so with my recommendations, I think it's important that we take the lessons that we've learned from COVID, not just because we continue to deal with this pandemic, but also there's some things we need to know about natural disasters. As you know, our institutions deal with fires and floods more and more regularly, as well as how we think about how we respond more generally. As was said just before the break, and I really wanted to amplify this, we have to avoid replicating inequality embedded in traditional responses. And higher education really has an opportunity for this, particularly because what we do on campuses doesn't have to be restricted by some of the overarching limits that sometimes appear in community responses to homelessness. As President Percy mentioned, we have to have basic needs hubs on campus that are central and accessible. One of my administrators at Long Beach, Jeff Claus, says, you know, we need to normalize basic needs supports just like we normalize financial aid. Like nobody is embarrassed to go get financial aid on a campus service on a campus. Neither should we have it such that students feel embarrassed to get access for their basic needs. Having a single point of contact or a person or a group of people, a hub that helps navigate students through campuses is key. We also have to develop and fund housing navigators and affordable housing resources. So in California, just recently, just last week, actually, we passed SB 169, which funds student housing strategies. Student housing on our campus is an auxiliary of our campuses, and it's its own money-making institution. And so if we explore expanding housing, we have to be careful not to think about housing as a boutique response to students to bring them in, but as an affordable response to housing. Some campuses are doing subsidy programs, but I think it was Margot this morning mentioned that subsidy programs are complicated when you can't find housing. It's great when I have this voucher, but if I can't use it, then it doesn't help me. So having a navigator to really link students to housing is so important. We have to target students who need these services the most. So we on the higher ed side have the data and analytics to determine who are the students who need support from our basic needs hubs. And then we can do some targeted and directed outreach to those students. Not saying, I know you're in need and here's how we can fix you, but saying, we are aware that you are the first person in your family to go to college. And we are awarding your commitment to your education through these supports. Not stigmatizing our students, but engaging them in a way that honors their input into themselves and also in our communities. I'm going to bump forward and talk about legislative advocacy because I know I'm running out of time. But I want to say that there are lots of efforts that have happened in California that have been very successful and we still have room to grow. So for things like SNAP, or what folks think of as food stamps, students are categorically ineligible for SNAP unless they work 20 hours and a number of other stipulations. And so right now in California and across the nation, we're working on removing that stipulation because we need to really honor that going to school is work. And that if students are successful, they then invest in us, in our communities. We also have to think about ongoing funds for these hubs that I've been talking about or that have been spoken before. Up to now, we've been using like duct tape, spit, and sheer will to respond to our students on campuses. But ongoing funds for these hubs means we can build infrastructure to make this institutionalized component in our environments. And we always have to amplify the voices of our students because they are the ones who tell us best what they need. I'm going to bump forward a bit and say, let's go here.
I strongly believe that education is the greatest investment that the society can put upon itself. An investment in us, which is the future, which is the next generation, is the most rewarding for an economy, for research, for science, for literature, for culture, the arts, and for any budget cuts to be coming towards us will dramatically affect us. They affect our health, they affect our future, they affect our progression out of poverty.
I feel like I'm preaching to the choir as I talk about the importance of addressing these issues. I know you all know this already. But I guess in our conversations, I invite us to think about how do we articulate these needs to people outside of our agencies and our institutions. As I talk about students who experience homelessness, I want to be really careful about reinforcing a hierarchy of worthiness. I think even some of my most conservative colleagues will say, well, I'm not sure I want to help, someone who's street living, but a student, it's a whole different thing. And I want us to be really careful about that. All of our neighbors who experience homelessness are worthy of support and engaged practices that acknowledge institutional bias and reinform and invest in them. For our students, this is a population that is just a part of our community that we have an opportunity to address. So in this picture, this is a piece of art that was done by an artist named Alicia Wormsley, who also happens to be my cousin. And these ladies are matriarchs in my family. And they are singing in my grandmother's backyard. We are a family who sing. If we're all in the kitchen, we're singing. If we're in the living room, we're probably singing. If we're on the front porch, we're probably singing. If someone's downstairs and we want them upstairs, we probably yell. But we are a singing family, and I am not going to sing for you today. However, I do want to say that the metaphor that I want to bring forward is that the great thing about a choir is that when we're all singing with all of our strength, at times I might need to take a breath and I may need to stop. But that means that the person next to me can bring more into the note while I take a breath and then join. And really, that's what we have to do in this work, is work together and honor our choir, right? For higher ed institutions, as we reach out to community-based agencies, I'm not clear that that higher ed folks really know how to engage community-based support. Often, what I see is our staff and administrators will schedule a meeting with folks. We'll all go to this meeting, and then that's the end, and we'll say we have a relationship with this agency. But having an actual relationship means an ongoing connection, and a meaningful connection that has a resulting action. For us at Cal State Long Beach and at 7 other CSU campuses, we've started college-focused rapid rehousing programs where we have a financial link to a community-based agency. For Long Beach State, that's Homelessness, Inc. And so we identify our students on campus and then refer those students to Homelessness, who then subsidize but also provide case management for students. And those students are supported on our university side with case management related to specifically to their progress in education. And it is that joined relationship that has been incredibly meaningful for our students. With that, I want to take a deep breath and stop and tell you that the CSU Basic Needs Initiative is an initiative that was developed out of our chancellor's office and includes the work of faculty and research and community-based agencies and quite a lot of legislative advocacy and support. One of the things that the CSU initiative has done is provided seed money for the Center for Equitable Higher Education, which I am the executive director for, along with CHE at Humboldt State. So together in our centers, we are very much focused on studying and promoting economic, food, and housing justice for our students. So we're really pleased to be able to support the work in higher education through research and advocacy. Thank you very much.
Thank you so much. That was so much information and clearly amazing work y'all are doing. So thank you so much for taking the time. We do have quite a few questions. I hope you're ready for a little bit more. And I will just begin with the first question that came in. Now that the level of students who face this uncertainty is known, what are the next steps for the future of creating better programs to help those who will still face these issues in the future?
Great questions. Thank you. Well, I think one of the things, sort of that I spoke about earlier that I want to double down on really is that I think a lot of us, often the first line of defense for a campus. So a campus, all of this, we know, okay, here it is, we've got it. And then often we will develop a food pantry because we're not sure how to house students, but we know we can get them some food, right? And I think that's incredibly helpful to do that. Now we're expanding to housing and thinking about how do we get creative and innovative with housing. I think a lot of folks also started out with doing the food pantry and then putting it on the end of campus so people didn't see. And so now we get to pull those forward and understand that it's important for us to see and bring in our students with love and support and not stigma. And I think the next steps for us is really to be equity focused. And really think about how do we make sure that the students who need these supports the most are getting it. I think it's been really helpful for us to have an expanded view, like not having students do a long questionnaire before they go in the food pantry, or really asking students to perform their poverty before they get some supports. And so really bringing in all students who express the need. And we also then have to think about that for a lot of students, I'll say for a lot of marginalized students, we've been told our whole lives, nobody's going to do anything for you. You're going to have to figure this out. And if you're going to be adult, you're going to be on your own and you have to work through it. But the frame of higher education is just ask us and we'll help you. We're here, just ask us and we'll help you. So this person who's been told their whole life to get your own self together then is expected to show vulnerability in a way that they've been taught not to. And so we have to then say, no, we're not going to wait for you to come to us. We have all the information we need to reach out to you and do that first. So I think that is all about an equity lens, which I think is the future of our work.
Thank you. So the next question I think begins perhaps rhetorically, but maybe not. Are you encouraged to see more and more schools doing basic needs insecurity surveys using your measures or measures adapted from those you developed is the first part. But the second part is, are there further adaptations we should be making to these measures? How often should schools be doing these surveys?
That's a great question. And we were doing this work in advance of some of the folks who are more acclaimed in the work now, right? And so, you know, and we have this small community of basic needs researchers. Well, frankly, here in my living room, it feels like we're an army, but really there's like 5 of us, you know, who've been doing the work for the longest. And so when we did the work in the CSU, we learned a lot. We worked with LASA actually to develop our homelessness measures, and then we're able to help support the Hope Center in their work, and we all work together, right? Quite often we work together. So it's lovely to see lots of people thinking about prevalence. The challenge for me is I think folks get stuck in doing prevalence studies. I think sometimes, I mean, it's important for us to have the data to support how many and how we want to address these issues. But I also think that prevalence studies sometimes become a barrier to progress. Like sometimes folks will say, well, we need to know the numbers first. But my question is, how many do we need to have for it to be important? And I'm really clear that we know that it's important and we have to respond. I think adding measures around food security and homelessness and other basic needs elements is really helpful when you integrate them in other studies. So when we're doing our big national or institutional studies and we add these numbers there, that can be really helpful rather than doing like yet another study, because our students who experience basic needs insecurity, as we talked about earlier, don't have a lot of time. They're going to school, they're going to work, then they're going to their other job, and they may be taking care of some kids. So we also really need to be careful about over surveying our folks.
Yeah, thank you. Excuse me. What are some additional considerations we need to keep in mind for immigrant, refugee, and/or students who do not have citizenship status? What are some additional barriers that these communities are facing to existing services?
Yeah, so I think for us, for instance, at Long Beach State, we got all these, during COVID, we got all the CARES Act funds, and those funds could go to students who had citizenship, but didn't go to our, for instance, undocumented students, nor our international students, right? And so we have developed specific funds and specific strategies to support our undocumented students who couldn't get access to federal dollars, and in some cases, state dollars. And I'm going to miss parts of your question, but before I do that, I do want to pinpoint that international students, I think the stereotype about international students is that they come wealthy. You know, our international students have to show proof to come to our institutions that they have the financial capacity to support themselves while they're here. But for many students, their whole family, everybody put all that money in the bank to show that they could do this because they need that person to get that degree from here. But then all that money is not actually available for our students. So our international programs and our institutions really have to, if we really want to B global institutions have to really consider how we support those students as well. And while I'm at it, I'm just putting a link to our report and our basic needs initiative in the chat.
Oh, awesome. Thank you. So thinking about the concept of the new traditional students that you mentioned earlier, what shifts will our institutions need to make to support this growing body of student experience in order to best support their learning experience?
Can you tell me that again?
Yes, absolutely. So we're thinking about the new traditional students that you mentioned. What shifts will our institutions need to make in order to support this growing body of student experience? Thinking specifically about their learning experience.
Yeah. So I'm thinking about, I mean, this is a whole nother session we could have about our new traditional students, right? I'm thinking about accessible and affordable childcare for our parents and supports. When we're thinking about supporting students, we can't just be thinking about the students themselves, but all of what they bring. Our students also have the capacity to inform us in ways, frankly, I think an 18-year-old can tell us what we need. And I think we have to acknowledge I still hear folks in higher ed calling our students kids. And I'm like, well, if that's the case, the kids are older than I am. And I'm older than I look, black doesn't crack. So, but our students, have the capacity to articulate their needs, and we have to listen to them. So I'm thinking about childcare. I'm thinking about understanding when we're thinking about financial aid, for instance, and financial aid determinations, thinking about what a family can actually contribute versus what their taxes might suggest, particularly in this pandemic environment.
Thank you. I appreciate that. So I think we have time for a couple more questions. Appreciate your patience and willingness to answer. So knowing that students are accessing services on campus, not through community-based organizations, what suggestions do you have for what collaborations with community-based organizations need to look like?
Yeah, so I think, the rapid rehousing piece that I was talking about is probably the most successful, or one of the most successful collaborative relationships, because the funding source came from the state. So the state provided $6.5 million to the CSU to develop rapid rehousing programs. A portion of that went to the higher education institution, but far larger portion of that went to the community-based agency. Clearly, our community-based agencies are already overtaxed quite often. And so if they can't expand their service provision, then really just funneling our students to them isn't helpful. So really there has to be an investment in that collaboration. I also think that us in higher education really have to understand how systems work, how continuums of care work, so that we are not asking of our community-based agencies things that they can't do. Similarly, there's an education process around understanding higher ed and how we work and how we move through the spaces. I know for me, I think people think that in higher ed that I'm off in the summer, and I'm not. But the calendar system and the academic system and all of that is different. And so really that knowledge base really has to be forthcoming. I think also sometimes our university institutions have to build a lot of trust in our communities, because too often faculty come into community spaces feeling like they're the smartest people in the room, and they don't know. I was about to use some terminology, right? But, we don't necessarily know what's going on. And so we have to come in with a great deal of humility along with our data, to build those relationships and to have those relationships take fruit over time. So it can't be just that one meeting. It has to be, how do we make this work? One of the other collaborations that has been really helpful for us is with CalFresh or SNAP enrollment. because our county workers who establish eligibility often don't know the changes that are happening for students. And so we definitely had to build relationships with our county folks who then we give SNAP application support on our campus. So we help our students apply for SNAP. But then when they have that eligibility call, that worker has to know, well, one of the exemptions for SNAP for students is that I'm work study eligible or I'm in an equity program. But that worker might not know that. So if we have a relationship with the county, the eligibility workers, then we build a seamless support from our institution to those services.
Thank you. I want to thank you so much for your time, for your brilliant work and taking the time with us today. We appreciate it. We are going to move into break, our last break before we come back for the final session. So it's 1:36. We'll return back here at 1:40. See you all in a few minutes.